Hey everyone, it's Jenna. Thanks for joining me today. In today's video, I'm going to be showing you a short routine that you can do, Pilates for pain relief. And this is specific for folks that are struggling with low back pain or hip pain. So I'm going to show you a quick and easy routine that is also very effective to help to restore your body's natural movement patterns, activate your core, give you more mobility in your joints, and help you to resolve pain at its source. So if that sounds good, then stick around. And I'm also having a Black Friday sale, 50% off of a bundle of 3 sessions with me. So if you'd like to work together and receive a personalized plan for pain and stress relief, then check out the link below and there'll be more information at the end of the video. So let's go ahead and get started laying down on your back. So we're just going to start here by taking a few long, deep breaths. And the suggestion here is to breathe in through the ribs, really expanding and opening the ribs side to side, and then exhale all the air out of the lungs. So we're going to inhale, breathe in for 4, exhale 2, 3, 4, 5, 6, 7, 8. We'll do that a few times. Inhale, 2, 3, 4, exhale 2, 3, 4, 5, 6, 7, 8. And already you might be feeling a little bit more relaxed. You may be feeling like things are starting to open, your back's starting to move, your ribs are starting to move. So that's why breathing is really our first exercise that we're going to do. Now the second one is a gentle pelvic tilt. And you can make this really small. So if you are experiencing low back pain and it's more acute and you're feeling very sensitive there, then you can make this movement really small. So I want you to start by taking a deep breath in. As you exhale, you're going to draw your abdominals to the spine. It should feel like a wrapping front to back, like you're wearing a tight belt around your hip bones. As you engage, you're going to gently imprint or press your back towards the mat. That's called a pelvic tilt. And then the second phase of the exercise would be to create a little arch under your back. So I like to teach this as doing this movement as small as you need to in order to keep your ribs down. So you can kind of use your ribs as a guide, because especially if you're more hypermobile, you don't need to do a huge movement here. If you're more stiff, you could do a larger movement. But the best way to discover that for yourself is to bring your hands onto your rib cage, and especially when you make that little arch under your back, then really only go so far to where your ribs don't change. And you'll see that as a theme that comes up a lot throughout these exercises, where we're working on moving from a joint and not allowing other areas of the body to go along for the ride, so that we can keep certain joints stable as we explore the movement of other joints. So now we're going to move on to the hip joints. Keeping a neutral spine, which is where you have just that little blueberry space under your back, you're going to again engage the abdominals. So this is where you have that wrapping front to back, like you're wearing a belt around your hip bones. You're going to keep that engaged as you lift one leg at a time. You'll notice how slowly I am doing this movement. And that's because you need to really learn these movements slow at first so that you can focus on the stability. And then as you start to practice that more and more, it'll be easier for you to layer on more challenging movements. So this is really working on back stability. Nothing's moving in the back as the leg is moving. Okay, so once you've got that one down, we're going to go ahead and bring both legs up, and we're going to use the abdominals to keep the legs up in this position. So take a deep breath in. As you exhale, start to sink your abdominals to your spine. You're going to keep that and tap one foot down, back up, tap the other foot down, and back up. Exhale, the leg will lower. Inhale, it will lift. Other side, exhale, leg down. Inhale, it lifts. Keep drawing the abdominals in. Each time that leg goes down, nothing's changing in my spine. Again, working on that back stability, supporting it from the core. That's really helpful for shutting off low back pain. Again, just learning how to move from the hips without your back moving along with it. It helps to reduce the force, the pressure on the discs of your spine, and really should help with any pain you're experiencing there. So now we're going to go into a bridge. And this can be really helpful also for pain relief because many of us are weak in our glutes. Pretty much everyone is weak in the glutes. So for this one, we're just going to do a neutral bridge, which is where you lift your hips up to the ceiling and then you allow your tailbone to lead the way as you drop them back down. So as you exhale, your hips lift up to the ceiling, your pubic bone will lift, and then you're leading from your tail as your tailbone comes back down. As you exhale, feel your glutes working as you come up into your bridge. You're still working the abdominals, feeling that wrapping front to back in your abs. Let's do 3 more, going nice and slow so that you can really feel this movement happening in your hips. I'm creasing at my hips to come down. I'm pressing the hips up to the ceiling to lift back up. Let's go ahead and from there, bring those hips back down. Very good. Okay, so from here, we're going to come up into a hands and knees position. On the hands and knees, this is also a good way to activate your abdominal muscles. So I'll take my deep breath in, breathing into my back. I'm going to use the exhale to draw the abdominals up and in towards my spine. So as I breathe in, I expand. As I exhale, I contract. And I'm pulling my abdominal muscles up and in against gravity. So you should be able to feel it a little more in this position. But what you want to avoid doing is tucking your tail under in order to engage your abdominals. You want to keep your tailbone lifted. Keep that neutral spine. I like to think about it like there are hot cups of tea resting on my spine. Nothing is going to drop or change as I draw the abdominals in. So now I'm going to start to extend my left leg back, my right arm forward, and bring it in. This is another practice for stability because a lot of pain conditions will stem from destabilizing the lower back or the spine. And so when we do these, again, we're just learning how to move from the joints rather than working from our back, which is especially important in the lower back. So let's do a couple more of those with as little shifting and wobbling as you can. So this is the prep for bird dog. You might already have seen that exercise before. So if you feel ready, we can go into that now. You're going to start by dragging your toes back, your fingers forward, lifting the arm and lifting the leg. Bring it down and slowly pull it back in. So now you might not feel ready for lifting, and that's fine. If you feel any discomfort or pain, then you can omit that and just go back to the previous exercise that we were doing before. Make sure you're also keeping your head lifted because that helps to strengthen the muscles in the back and the neck. And notice how I am not arching my neck back or tucking it under, but it's neutral. So we're just going to do one more time like that on each side and go ahead and bring it down to rest. So from there, we're going to go ahead and come down onto our side. So for a lot of people, when they are in pain, lying on their side is one of the positions that doesn't hurt because it doesn't put pressure on the discs in your back, and it can generally just feel like a pretty comfortable position. The first thing we're going to do is a clamshell, and this is to strengthen the muscles in the hip, the deep hip rotators. So I pull my abdominals in as I lift, using my exhale to open the knee, my inhale to close the knee. I have my top hand on my hip so that my pelvis isn't rolling back, but that my top hip is just staying stacked right over my bottom hip. Let's do 3 more like that. And last one. From there, go ahead and straighten your leg, flex your foot, and we're going to lower and lift the leg. So all of these exercises are targeted to work on the typically weak muscles, the smaller stabilizing muscles as well. So here it's your glute medius. It's a muscle on the side of the hip. It has a lot to do with stabilizing the hip and is really important for our gait. So this is a great exercise to work on strengthening that muscle, especially if you're dealing with hip or low back pain. So let's do one more like that. And then we're going to work on some spinal rotation. And one of the easiest ways to do that is to allow gravity to assist you. So in this position, when you take your arm back, gravity is drawing my arm down, and that's helping me, along with the weight of my arm, to go into spinal rotation. But again, I'm stabilizing my low back. So I'm squeezing my knees together as I allow my chest to rotate open. And I'm really trying to keep my hips stacked as I do this so that I'm not moving again in my lower back. Shouldn't feel any pain in your lower back. If you do, just make that movement a little bit smaller. Let's go ahead and flip over to the other side. So let's go ahead and start with those clamshells here. My neck is relaxed. I just have my head resting here on my bottom arm. And I'm lifting and lowering my top leg. I want to feel like there's a hinge at my sitting bone area so that when I'm lifting my leg, I'm really working those deepest lower hip rotators. Okay, let's do one more there. And then I'm going to straighten my leg. I'm going to really open the front of my hip so that I'm not flexing my hip at all as I lift and lower my leg. I'm going to exhale, lift, inhale, lower. Drawing my abdominals in, drawing my ribs back and in. Let's do 3 more like that. 2, hips are staying stacked, and last 1. Very good. So let's go ahead and just bring our knees together. And notice how I pulled them a little closer to my chest, and that will help me stabilize my pelvis, stabilize my hips as my arm goes back. So again, if you feel any pain in your back, your hips, your SI joint, then just make this movement a little bit smaller so that you feel the rotation as opposed to the movement in the lumbar spine. Very nice. Go ahead and lower that arm down. And that was a short routine that you can do that should help you to alleviate pain that you may be experiencing in your lower back or in your hips. If you would like to learn more and develop a routine that is specific to your body, I am doing a Black Friday sale right now, which is a bundle of 3 sessions with me called the Pilates Stress Relief Reset, where we can go over exercises, movements that are specific to your body and what's going on for you. And then I also will incorporate sometimes meditations that work with the subconscious mind, work with our beliefs, what we actually think about ourselves when it comes to our body, and some of the deeper reasons why we may be experiencing pain. I also do nervous system regulation practices for stress relief for my clients, which really helps to address the underlying reasons why they may be experiencing pain, which often comes from stress. So it's a 3-pillared system that works on the physical and the emotional and the mental. So we cover mind, body, and spirit. If that sounds interesting to you, then check out the link below. The sale's going from the 29th and ends on December 1st. So check that out before it ends, and take care.